Earlier today, Dr. Keith Lehman, Chief Provincial Veterinarian for Alberta, and I released a statement to inform Albertans that a confirmed human case of variant influenza A H1N2, an influenza virus typically found in swine, has been detected in Alberta. This currently appears to be one isolated case. It is also the only case of influenza that has been reported so far this flu season. Influenza viruses that normally circulate in pigs, including H1N2, can infect people, although this is not common. While this is the first reported case of variant influenza A H1N2 in Canada, 27 cases have been reported globally since 2005, when reporting became required. All have been linked to direct or indirect contact with swine, and none of the previously reported cases have caused sustained human-to-human transmission. This case was detected in mid-October after a central Alberta patient sought medical care with influenza-like symptoms. The patient experienced mild symptoms, was tested, and then quickly recovered. There is no evidence at this time that the virus has spread further. As part of Canada's obligations under the international health regulations, we are working closely with Alberta Agriculture and Forestry and Alberta Health Services Local Public Health to determine the source of the virus and to verify that no spread occurred. We are also connected with the Public Health Agency of Canada and other partners across Canada to ensure clear communication on this investigation. Retrospective testing of Central Alberta COVID samples from the past 2 weeks for influenza is almost complete, and no influenza-positive samples have been found. Starting today, AHS will also proactively offer influenza testing to residents of parts of Central Alberta if they are presenting for COVID-19 testing at an AHS assessment centre. This testing will be optional and supports our ongoing influenza surveillance in the region. We are taking this seriously, as any human infection with a non-seasonal influenza virus needs to be followed up under our international obligations. I want to be clear, however, that there is no evidence of risk to the public. H1N2 is not a food-related illness. It is not transmissible to people through pork meat or other products that come from pigs. There is no risk associated with eating pork. We are providing this information in the interests of transparency. We will investigate this thoroughly and keep Albertans informed of the outcomes of this public health investigation.
It's not unusual for us to see influenza in our swine populations in Alberta, in Western Canada, and for that matter, around the globe. Within Western Canada, we have routine surveillance that is undertaken for our swine farms, and we tend to see anywhere from roughly a range of 10 to 30 cases identified per quarter. So it is a virus that is not uncommon in our swine populations, and with that, that's pushing us in that direction for the animal health investigation.